Sharing.
After this is done, turn off the share screen, hand me over the host, and
Okay.
then go ahead again. But before that, let me just make sure that you're actually live on the page. Just one sec. Yes, we are
Yeah,
live.
I
So
see.
go ahead and turn off the share screen, hand me over the host, and begin.
Okay, stop sharing. And here you are. Mm, um, Allow to record, make host. Yes. Are we good?
Yes, you are. Go ahead, begin.
All right. Good afternoon, everybody. We had some technical difficulties, so we have to do this all over again. Good afternoon. Welcome. Today is our June event. We are talking about children and mental health, Rahma Worldwide, and Mental Health America of Southeastern Michigan. We have our two guests today. We have Anthony Flaveras and Jessica Cortez. Both are professional mental health professionals, and also they have all the background information and education in being a part of our event today. So let me just introduce my guest and move on. We have Anthony Flaveras. He is an MA in LLBC. He is a school counselor working at the elementary and middle school level for over 10 years. He advocates and mediates for children and families to have a voice. Mr. Flaveras also practices as a limited license counselor within the communities. He specializes in working with children, adolescents, and young adults, and as educational and social emotional therapist. Welcome, Anthony. It's good to see you.
Thank you.
Thank
Welcome.
you. We appreciate that you are taking your time during the weekend, and I'm sure everybody has their own agenda, but we appreciate that you're joining us today. We
My
also have
pleasure.
Jessica Cortez. She is an LMSW, as a child and adolescent therapist in Bloomfield Hills, Michigan. She has worked with children and families in the clinical setting for over 9 years. Her practice specializes in helping children create coping tools and communication skills. She is also the author of a children's workbook, The Thinking Traps. Wow, we have an author in the house. Thank you, Jessica, for joining us today. Also, taking time from your weekend. I'm sorry about that, but we appreciate your presence. Thank you so much.
Sure. Of course.
All right,
Thank you.
so let me go back to my intro. So, this month's event is dedicated to children and mental health. Mental health in children and in childhood means reaching developmental and emotional milestones and learning the healthy social skills and how to cope when there are problems. So in most cases, these are just typical developmental phases. However, there are behaviors that may indicate a more serious problem in some children. Mental disorders can begin in childhood. So according to the CDC, ADHD, behavior problems, anxiety, and depression are the most commonly diagnosed mental disorders in children. So, as I was saying before, raising children can be a challenge, but it's absolutely a challenge. So, even under the best circumstances, their behavior and emotions can change frequently and rapidly. So, all children are sad, anxious, irritable, or aggressive at times, or they occasionally find challenging to sit still, even pay attention, or interact with others. So, in most cases, these are just typical developmental phases. However, such behaviors may indicate a more serious problem in some children. Mental disorders can begin in childhood. Examples including anxiety disorder, attention deficiency hyperactivity disorder, which is the ADHD, autism spectrum disorder, depression, and other mood disorders, eating disorder as well, post traumatic stress disorder, PTSD. So, without treatment, however, these mental health conditions can prevent children from reaching their full potentials. So, many adults who seek mental health treatment reflect on the impact of mental disorders on their childhood and wish that they have received help sooner. So, today we have our two professionals. So, we really appreciate that. We are going to tackle some of the issues and some of these questions that we will be putting them for talking topics. Again, my name is Kayla Moflahi. I am a Rahma Worldwide Program Manager and a Mental Health Program Coordinator. We really appreciate that you are tuning in with us in this Saturday evening. So some of the questions that we are going to tackle today are what defines a child's mental illness? What are the barriers to treating childhood mental health disorders? What are the common disorders among children? What are the standards used by professionals to diagnose a child with mental disorder? And last but not least, what are the most practices used to treat children with mental disorder? So please, I'm going to give the chance now for each of our hosts to actually introduce themselves and to start off talking before we even start the panels, or you can just go ahead and swim and dive in these questions. Jessica?
Hello, thank you. Thank you for having me. So I run a small mental health clinic. We specialize only in children and adolescents. We have about 10 clinicians, and what we see is what you've mentioned, a lot of anxiety, ADHD, behavioral issues, depression, and of course, after this year, a lot of life adjustments. So we do focus solely on treating children and adolescents. I went to undergrad at Michigan State University, and then I did my master's in social work, clinical social work at the University of Michigan. So we are located in Bloomfield Hills. And yes, I'm the author of The Thinking Traps, a team of troublesome thoughts, which allows elementary age students to learn about the type of thinking errors or thought distortions that happens when maybe someone is anxious or depressed. So I know Anthony, maybe he could introduce himself and then we'll kind of dive into some questions if that's okay.
Yes, please go ahead, Anthony.
All right, thank you, Jessica. Thank you, Kay. So I'm Anthony Flaveras. I've been a school counselor for a little over 10, 11 years in the Bloomfield Hills area, grades from 5th to 8th grade. But I've also was a counselor in 2 elementary schools in Birmingham at one time. Especially in this time and age, with the pandemic and all, I've seen a huge increase in anxiety. Kids worrying about going back into class, worried about their peers and what they think. Many distorted thoughts, as Jessica was saying, in regards to their thinking, which has been affecting their education as well too. That I'm glad to see that some of the barriers of mental health are breaking down, where we're having more kids are seeing therapists like Jessica and some of her clinicians that she has at her clinic. I know that it's very hard to get in to see a therapist these days. I appreciate this time with Rahma International to have us on board on a very important topic, and look forward to answering whatever questions may come our way. So thank you, Kay.
Thank you. I appreciate that. Thank you so much for that brief intro. We know that children's health is very, very important, and it does impact their life during their childhood, and it also takes on through their adolescence and move on to them becoming older. So let's talk about defining what is children's mental illness.
So clinically, when we look at what is mental illness, and usually we look at a basic criteria of are symptoms, behaviors, or moods, are they impacting more than 2 or more than 1, at least 2 environments, right? So that could be the educational environment, that could be home life, and personal life. It could also be extracurriculars. So you're really looking for, are there moods, behaviors, kind of outbursts or a low mood? Is it impacting more than one environment? If it is just impacting, let's say, home life, that might not necessarily mean a mental health diagnosis is necessary. It might be more of like an adjustment. Some parenting pieces might be needed at that point, but we're really looking for enough symptoms through the DSM-5 where we're looking at more than one environment where there's trouble.
All right. Anthony, would you like to jump in, give us more clarification or some examples?
Yeah, as far as what Jessica was saying, I mean, one thing as a school counselor I'm looking for is changes in patterns in kids. If they're struggling academically, or if they were successful academically, and then all of a sudden you start to see some changes in their academic performance, behavioral issues that seem to pop up out of nowhere that are uncommon for the child. Usually when you dig deep enough, you find that there's some type of anxiety or pressures or depressions that these kids are dealing with. I think one thing that really affects kids, and sometimes I think labeling a child with a mental disorder is easy to do, but I think a lot of that is really tied into anxiety or lack of skills and being able to cope with the daily stresses that kids are encountering. I know at the age group that I work at, kids are starting to develop. They're getting hormones, new feelings, emotions that they've never dealt with before, and really don't have anybody kind of guiding them in regards to how they respond to those feelings, how they respond to those emotions. And, I think if it goes on long enough and it's untreated, that's where you start to see where it starts to turn into a mental disorder and can severely affect their lives.
Absolutely. Thank you so much. So I have a brief video, so I'm going to show half of it, and it's called Talking Mental Health, and it's really, really very enlightening. I'm going to share my screen right now and go ahead to the video. Where are we? Let's see. It was a YouTube video. I'm sorry about that. Okay. I had it here somewhere. I'm sorry. Just stop sharing for a minute so I don't want to show everybody my business. Just give me a minute. I'm sorry about that. Let's see. Where are we? It's YouTube. Here we go. No. Go back to document.
How do I turn off the camera on this?
Kay, please unmute yourself when you want to start talking.
Yes. Hello. Let me unmute. Here we go again. All right. Can you hear that?
This film is about mental health, talking about it and listening to others.
Mental health is about our feelings, our thinking, our emotions, and our moods. Everybody knows how to look after physical health, but looking after our mental health is just as important because you can't see it, you need to talk about it.
Good morning, Afia.
Good morning, Miss.
Good morning, Kai.
Good morning, Miss.
Good morning, Jack.
Good morning, Miss.
Good morning, Alex.
Good morning, Miss.
Good morning, Sid.
Good morning, Miss.
Good morning, Sophie.
Good morning, Miss.
Good morning, Jay.
Good morning, Miss.
This film is all about Jay and us. We're her friends. We're all 10 or 11 years old.
All in the same school, live in the same area, but we're all very different to each other.
We all have different feelings every day. They come and go.
You can feel excited,
Silly, angry, nervous, grumpy, confused, lonely, happy, confident.
These are small feelings that we all have every day. What can we do when small feelings are bothering us?
I like KFC, or I like going in the bath. I would probably write it down. You'll feel it's out of you and on the paper. I usually read a book, so I can just escape into the book and then my worries are behind me. When I feel stressed, I usually just turn the shower on and sing in the shower. Just like sit down and play on my favourite video game, really. You could count until you don't feel stressed.
Sometimes we can have big feelings and they don't go away. Big feelings can affect our mental health.
Big feelings can stop us getting on with our lives. They can change how well we feel, how we behave, how we see the world, and how we get on with other people.
Some of Jay's feelings stayed too long and they got too big for her to manage on her own.
What's wrong with Jay? She's usually mature and good at getting her work done.
How are big feelings affecting Jay?
Am I in a jungle? Am I in the sea? My head is going crazy. Will you come and save me?
My tummy hurts. I can't get to sleep at night. I can't concentrate at school. It feels like I have a volcano inside of me getting hotter and hotter.
All right, so I'm stopping here and then we can resume at the end. So basically, what we want to actually show about mental illness when it comes to this video, it's basically mental illness disorders in children are generally defined as delays or disruptions in developing age appropriate thinking, behavior, social skills, or regulations of emotion. So these problems are distressing to children and disrupt their ability to function well at home and in schools or in other situations. So now we're going to run on to our second question, which is, what are the barriers to treating children mental health disorder? So we'll start off with Anthony this time, since we started with Jessica before.
Yeah. So in regards to the barriers that that mental health professionals have dealt with over the years is essentially the stigmatization of that mental illness is something that should not be shared, that should be private, that the stigma that there is something wrong with you if you express concerns or struggles in your life, or handling the moods or coping skills that you've accumulated over the years. I do see great progress in this area, though, that we're seeing more and more kids, and I know professionals like me, spend a lot of the time trying to identify those kids that might need somebody like Jessica Cortez to help guide that child and teach them skills to be able to cope with the many feelings and emotions that we deal with on a daily basis. Another thing that creates issues for kids to see mental health professionals is maybe lack of money or insurance to be able to afford to go see a private practice therapist. And Jessica could speak a little bit about how that works in regards to pay scale and our ability to be able to adjust our fees to be able to service clients.
Yes, go ahead, Jessica.
Sure. So yes, Anthony, is spot on as far as, oh, sorry, is he still talking? Can you hear me?
Okay.
Okay. Can you hear me? Okay.
I can hear you. Yeah. Go ahead.
Okay. So obviously the stigma, I do agree it's getting better. I think there are certain cultures that would, shy away from talking to a therapist, having like a talk doctor, or doing, medication management. So I think that is a barrier, absolutely. I think low socioeconomic status, SES, also impacts. As far as what facilities are offered, even transportation, or if there's, if it's a single parent home, how do they get a child, if they're working full time, to a therapy session. I think also a key is how often families are sharing what they see at home. Obviously, someone like Anthony is a huge support at a school setting, and those are great ways to start noticing early signs of problems, because counselors like Anthony, who really care about those kids at school, are getting to know them and might start to see the changes or hear the concerns from teachers or peers. And so it's important that there's not a barrier in communication with the school. Similar with pediatricians, are you going to regular visits with the doctor and filling out the assessments that they might have as well? I know as children age, some pediatricians might give them like the scared assessment for anxiety, or, when they're younger, they might do the ASQ to start looking at developmental delays. So that's always important. So of course, if children aren't going regularly to those appointments, that could be a barrier as well. And as far as accessing therapy, obviously there's community mental health agencies, CMHs. So if someone is in, Medicare, Medicaid, if they can't really afford out of a private pay, or sometimes private practices have sliding scales, right? Looking at income and making changes to the fees to accommodate. So there's always resources. The tough part is how many resources are families aware of? I think it's really crucial that people are aware of what's in their community, various different types, right, of outpatient clinics or private practices or community mental health agencies. But it's really about trying to know those resources, know when to call. And I think pediatricians and I think school counselors are a great first step to start noticing, because they know those kids so well.
Very well. So let me just add in
Okay,
that. Yes, go ahead, Anthony.
Okay, I just want to add one other thing too. I think one other barrier that we run into too is that if a child ends up going to a therapist and that therapist is not a good fit for that child, that they may automatically then think that therapy is not for them. I think like in any profession, you have, people that are really good and are good fits based on personality. So I think making sure that one sticks through, therapy, and if it's not working with a specific therapist, that they continue their pursuit to find somebody that can help them, but not to stigmatize that when there's 3 sessions with that therapist and saying, oh, this isn't going to help. It's a process.
Yeah. And I think that's a really good point, Anthony, because I know in my clinic, I always tell the clinicians who work with me, if a child is starting to get resistant or doesn't really want to open up, I would rather have them take a break or see if there's a better fit somewhere, so that they don't get a bad idea of what therapy is, because I want them to be adults and say, yes, therapy is helpful. If I'm 35 and I need a therapist again, I don't have that bad taste in my mouth. I think it's a really good point.
So Jessica, let me ask you that. So if you have a teenager coming in for a therapy session, and after maybe 4 weeks of therapy, this teenager just decides that they are better and they no longer want to be in the sessions, even though against the advice of the parent. So we want this child to actually feel comfortable, at the same time get the help they need, and perhaps they need more sessions. So how do you go about when the parent tells you that their child is not they don't no longer want to be in therapy, even though they want them to be in therapy?
Yeah, it is very tricky. And of course, obviously it's, patient centered, right? So it really is about this child and what they're, verbalizing. And so usually what I try to do is negotiate and say, I hear you. I know you don't want to be in therapy for the next 6 months. My clinic is pretty short term. We try to keep people, 6 to 9 months of skills. So I might negotiate, Can we work together for 4 more sessions? We'll really focus on skills in those 4 sessions. We'll have a time restraint on it because I do hear you and I want you to feel like you have this voice, but I also think there's a little bit more work or reminders that I'd like to go over with you. And so a lot of times if they know, at least there's maybe a countdown of like, let's work together for a set amount of sessions. And then later on, you call me, you're back in the school year, school gets really hard, your depression kicks in the winter, you come on back. But sometimes it's a negotiation of maybe we set an amount of sessions left together. And that way we're still really trying to pump in different skills with the time we have.
Very good. So Anthony, let me redirect you here. What do you think? What are the what should schools adopt when it comes to proactive approaches like school-based positive behavior and intervention and support?
Right. So there, over the years, there's been a big movement towards this PBIS, which is the positive behavior intervention system that they are implementing in schools to be proactive and teaching kids to be able to have, just to basically learn basic behavior expectations that the school and adults have within the building, like respect and kindness. And through this positive behavior initiative is basically to praise students for the way they respond to situations.
Okay, I'm so sorry. Anthony, but it looks like you're cutting off as you are speaking.
Of consequential behavior and punishment, and focusing on teaching those kids, rewarding them, and reinforcing those positive behaviors that they're seeing within schools. There's been a big shift towards that over my career, actually, towards that structured plan that we have in place, or at least this. Oh, I'm sorry. Can you hear me?
Yeah, I hear you now. It was cutting off, but yeah, you can finish your sentence and we go ahead with the next question. It looks the weather is taking a big hold on all of us here.
Oh, can you hear me?
Yes,
Okay.
I hear you. Yes.
Hello?
Yes, we hear you. Go ahead.
Can you hear me?
Yes, we hear you.
That schools have in place. And
yeah, you are cutting off. I am so sorry. It goes back and forth, I guess. I'm not sure. All right, let's move on to our next question and see if you can adjust your phone. Okay, Jessica, are you there?
Yes, I am.
Yes, thank you.
One thing I really want to stress.
All right, so our next question. Our next question is talking about the common disorders among children. So what is it that you guys see the common disorder around children at the moment? Go ahead, Jessica.
So with this really tough year with COVID, or I guess a year and a half, a lot of it was life adjustments. So adjustments, what is typical with big changes is 6 weeks where we're not ourselves. So it takes 6 weeks to really get to a place where we're more common behaviors and coping. And then if after 6 weeks of a big adjustment, right, so a new school or a death in the family, After that point, it would become more significant if it goes beyond the 6 weeks. So we've seen a lot of adjustment disorders with trying to go into virtual learning or parents at home, kids, obviously not going and socializing or losing extracurricular activities if they were pretty involved in, clubs and sports and things. So that's obviously probably the most common diagnosis we gave this year. And then also another primary one is ADHD, attention deficit hyperactive disorder, the inattentive type. So not necessarily the hyper type, but more of the lack of focus, hard time reading and remembering what we read. 1 in 5 people actually has ADHD. It's very, very common, one of the 3 types. So that's obviously one that we're always testing for or ruling out. And I guess similarly, a lot of times the symptoms look very similar to ADHD, someone who's inattentive, to anxiety. So that's probably our third most common diagnosis is generalized anxiety, where someone has those worries, has those fears, and it really does impact their day-to-day functioning or their memory. Sometimes they might isolate and not want to be with friends as often because they've got this busy brain that, predicts bad things and all of those thinking traps that I work with in my office. So generalized anxiety, again, especially from this last year, kids much more nervous when there was a shutdown as far as what that means and health and safety, losing loved ones. That was very, very common this last year.
Very good. Yeah, it is. It is very difficult for all of us to adjust with this whole COVID-19 and being virtual all the time. Just wondering, where's Anthony? Oh, Anthony, there you are. So, Anthony, how is it that you were able to counsel students being in that virtual setting? Can you hear me?
Yeah.
Yes, can you just give us a little clarification here and something that you can share with us? How was it that you were able to adjust to the COVID-19 virtual setting of telecounseling, perhaps we can call it, like therapy? Were you involved in any consultation virtually, and how did it impact those students, and how do you feel about it? Okay, I don't know, I think we're having some hard connections with Anthony. All right, so whenever you're ready, you can just jump in. All right, so I want to show the rest of the video, and so I'm going to share my screen.
Sometimes it might help to talk to someone about our feelings, but it can be hard to find the right person.
Do you think your mum might know something's wrong?
My mum has her own problems. She's not very well. I've been looking after her.
What about telling Miss Evelyn?
She's always busy.
What about your sister?
I wanted to talk to her, but how could I say it?
Sometimes it can be difficult to know what to say.
Can I talk to you?
I've been having a really hard time lately.
Please help me, I'm really struggling.
If someone wants to tell you something, how could you be a good listener?
If you're listening to someone, you can lean forward or sit side by side. Make them feel comfortable.
Always listen to them.
Give them your time and attention.
If you're a friend, you might not know what you could do, but you can help the person find an adult who can help.
Let's see how Jay got on.
Hi, I'm Jack. I don't go to school with Jay, but I go to swimming with Jay. It was me she decided to talk to, and I was worried about her. I told our coach because I thought she knows the best thing to do.
I can see now that my problems are too big for me to deal with on my own. Other people have ideas and experience. There are lots of choices. I just had to think it through. Talking to someone didn't magic all the bad things away, but it did start to help me to change things, and it was good not to feel I was on my own. I'm 11 years old, and I realized if I wanted things to get better, I just needed a bit of help.
If your feelings are getting too big to cope with on your own, talking to someone you trust might really help.
All right, here we go. Um, that was so insightful, I think. This tells you how kids think and how they try to cope on their own, and as you see at the end, the slide at the end of the video, it tells you how is it the collaboration of friends, teachers, and everyone around, parents. This is like a whole collaboration of everyone when it comes to mental health in children. So that's something to really pay attention to. Welcome back, Anthony. So you want to dive in and give us more insightful stuff about the telecounseling, perhaps, and the COVID-19, how it hit the school, and you as a counselor, how did it really affect you and impacted children as well?
Yes, I first I apologize for the technical difficulties that
It's
I'm
okay.
having. I think one thing that the pandemic has shown us is how difficult it is to learn online for children. One of the biggest issues I had at the beginning of the year sure that they were present consistently through classes, and that seemed to be
I am so sorry. We are still having
really
difficulties.
the biggest issue is just kids being able to stay focused, stay on topic, to be proud to grow up a lot. Oh, sorry about that. Okay. So, can you hear me?
Yes, we hear you. Sometimes you go back and forth. So let's try it one more time. Go ahead.
Yeah. So just in regards to the online learning and kids being remote in school, it has been very difficult for them to stay focused, to stay on topic, to be disciplined with showing up in class and remaining in class online for hours on end in a day. It's been very, very hard for our kids, even with the returning back in person, the anxieties that kids have with being away from one another for so long, the lack of interactions that they've had socially with one another has been, it's almost kind of like they had to kind of learn their way to get back into school and to make friends again. And for many kids, that was very difficult to be put back in that situation after not being in person for quite some time.
Yes, absolutely. I agree with you. I've been an instructor as well, and I've seen the big difference with the students and how it's so hard for them to be intactly tuned with lessons and try to be, more fun and give activities. But virtual learning will not take place of in-person learning nowhere and anytime soon, even with all these technologies, being available.
Yeah.
Children, for the best well-being of children's mental health, I think, is to be normal and to have this normal setting of learning, and of course, the social setting for children is the most important aspect when it comes to learning. So I do agree with that. Thank you so much
Okay.
for clarifying that. Yes, go ahead.
Yeah, I was just going to say that, and it's been hard as a school counselor to be able to identify a lot of these kids and some of the social emotional issues that have come with the pandemic due to being online virtually. I depend on my relationships with teachers, with parents, with kids to be able to identify changes in behavior, changes in patterns that I can then intervene and structure whatever interventions that need to be in place, accommodations, or even referrals to private practice like Jessica has. Having those face-to-face interactions and those relationships are key in being able to identify our kids that are struggling. and it's been very difficult doing that, working online.
Yes, I agree. Jessica, would you like to say something?
Well, I was just going to say how in tune Anthony is in particular. You know, we've shared kids over the, you know, probably 5-6 years, and the phenomenal impact he makes on kids when he can be there in person with them. You know, you really do see the impact of a good school counselor, you know, noticing what these kids are missing, pulling them in, creating groups for them, making a safe space in the school for them. I mean, it's phenomenal what work the school counselors can give to those kids, you know, and I think Anthony does a phenomenal job. So hats off to him.
Absolutely. The best collaboration when it comes to
Thank
these
you.
issues with children is when it comes for the school to provide this kind of help, and for the counselors to also collaborate with parents, with therapists, and it becomes it's a whole circle here. It can be one. It can be one without the other. And again, you know, it is patient centered, as you already explained that before. Whatever is the best for the child, we want to strive into making the best you know therapy or the best consultation possible for them. Lots of children are going through a lot of hard time lately with adolescence and with everything that's happening in the media, all the issues. Mental illness actually, it's a big, huge misconception and misunderstood concept when it comes to children, and especially with different cultures and different backgrounds and ethnicity and religions. It has been a really huge problem for most of the youth or children who might be going through a mental illness, but it's not being recognized with family members or them themselves. So we want actually to have this mental health awareness when it comes to children, and hopefully we will do more of an in-person workshops, and with your help and collaborations for all the communities here in Michigan, and we'll also have it broadcast virtually as well, so everyone can get the benefit of the education background they need, or even just the tips and clues in how to recognize a child's mental disorder, or just a problem that they may have been going through. So thank you so much for that. So our last question that we're going to tackle, and that will be after that we will conclude, is what are the best practices used to treat children with mental disorder? That will be going to Jessica, and of course Anthony will also include himself in that as well, with noticing all the different disorders that some of the students are going through.
Mhm.
Go
Yeah.
ahead.
So best practice, you know, really again is the patient centered. So it's meeting the child where they're at that time. You know, working together on treatment goals where the child is identifying things that could be helpful, and it's not just led by an adult, you know, either a parent or the therapist. And really, we want to look at evidence-based practices, right? So what is the best evidence-based practice? So currently, as far as mood disorders and anxiety, your really two best practices are cognitive behavioral, CBT, and dialectical behavioral, DBT. And those are have been researched for, you know, a very long time, as far as linking feelings that we have that are automatic, realizing that they're stemming from thoughts, and that those change our behaviors, right? So the cognitive behavioral is how everything is connected. So, you know, I always tell children when I first try to explain why we're treating this, or how we're going to treat like worry thoughts or sad days, is, you know, I can't just tell you to feel really angry right now. You can't just have the feeling. It's coming from, you have to think an angry thought or something that's going to make you feel angry, and then that's going to create the emotion. So a lot of this is psychoeducation. So I think, you know, that's always at the root of therapy sessions, especially with children, helping them understand, how does their brain work, how do these thoughts happen, what are common, you know, thinking, you know, thought distortions or thinking traps, and then using what is evidence-based. So that could be play therapy, again, like CBT, and then of course, just kind of talk therapy, right? Working through maybe past trauma. If it was significant trauma, there might be EMDR, you know, the rapid eye movement, desensitization, that helps with some of the trauma if a child has also, you know, undergone any of that.
Very good. Anthony?
Yeah, and just to follow up on that, I you know, I agree with everything Jessica said. I think one of the great benefits of having a therapist is giving that child the ability to be able to open up and to share things. One thing I always tell with my students on my caseload is that you can't help anybody that we don't know needs help. And I think learning to be comfortable and sharing one's emotions and being able to express them to someone that they trust and feel comfortable with allows then that practitioner or parent or teacher or what have you to be able to come up with a plan to be able to resolve the issue. I think the biggest problem that we see is that, you know, a lot of these children, they'll keep things within themselves. They will not share their feelings, they will not share their emotions, or, you know, they'll go to a friend or sibling that may not have that experience in being able to cope with things in a healthy manner. And that's where sometimes you'll see kids will pick up destructive patterns in being able to try and cope with their mental health issues, and could lead to even bigger mental health issues if they're not handling them appropriately. But I think just having that ability to be able to be open and free with someone, to talk to someone who would be non-judgmental in their approach, and making that child feel comfortable through the rapport that they've built, to be able to talk freely and openly, so you know that child or student and therapist or counselor can then come up with a plan to be active in trying to resolve you know the concerns that they're dealing with. And sometimes that might need to go to a physician or a psychiatrist and getting medication to help supplement the talk therapy. You know, there's no magic pill that solves these problems, and I think it's a combination of therapies that can lead to success.
Absolutely. Thank you so much for that. Really appreciate all of the information that you have shared, both of you, Jessica and Anthony. Actually, I just posted in the screening. We have the screening tool in our website, Rahma Worldwide. .org/wellness. So this is something that, you know, all parents or even children can actually go in and take a screening and to see what level of depression, anxiety, or any other disorder they might be going through. But this is not a diagnosis. However, it just give you a little push in understanding your feelings or your child's feelings or what their child is going through, and it will actually give you a little understanding if they, based on the results, if they need therapy or they need to be referred to a therapist or a psychiatrist um, or just someone to talk to. So please, everyone, take the chance to go to our website, Rahma Worldwide. .org/wellness/ and take the screening, and it will be really beneficial and a good tool for everyone to start off with understanding children mental health and parents dealing with children's mental health as well. So in conclusion here, before I give the conclusion to our guests, I would like to share some of the stuff that I put together. So there are 5 warning signs for mental illness that we ought to all follow. First one is the excessive paranoia, worry, or anxiety, long-lasting sadness or irritability, the extreme change in moods. A person might be challenging the extreme moods, and they could be bipolar. Social withdrawal, dramatic changes in eating or sleeping patterns. So parents, please pay attention to these warnings, and don't take it lightly. There are 7 common types of mental disorders, including, as both of our professionals already mentioned, depression, anxiety disorders such as generalizing anxiety disorders, social anxiety disorders, panic disorders, and phobia. There's also the obsessive compulsive disorder, the OCD. There's also the bipolar disorder that I mentioned before when it comes to moods and changes of moods. The post-traumatic stress disorder, which is the PTSD, and schizophrenia. And lastly, the access to a mental health treatment, early diagnosis, and appropriate services for children and their families can make a huge difference in the lives of children with mental disorder. So access to providers who can offer services, including screening, referrals, and treatment, varies by location. So our best chance here, we know we trust our children to go to schools. I, as an instructor, as a teacher as well, I have seen children going through some kind of a discomfort, some kind of a problem, especially now with the COVID-19 and the isolations, being in virtual learning. It's been really difficult for parents as well to adjust to that. So it's a whole change here that comes from family, school, institutions, community at large as well. So we really appreciate everybody tuning in with us today and learning these tips, and hopefully that we get to also give you a little insight information. And I know there was a lot of enlightenment here happening with our counselor and our therapist. So thank you so much for joining us, and I would like to give the microphone to Jessica and Anthony to add in anything they want to for our conclusion with our guests. Please go ahead.
Well, I would just like to say thank you, Kay, for inviting me to speak to you all about mental health. I think a key is just kind of remembering children don't live in a bubble. So always looking to, figure out how we can support them, using schools and other families and activities, and really try to help them grow as best we can. But I think what you guys are doing is fantastic. And I really appreciate the time.
Thanks so much, Anthony.
Yeah, I agree with everything Jessica said. I appreciate you bringing this enlightening information to Rahma International and everybody who's viewing. This is a very serious and important topic for our kids, and I think the more that we can educate people on what kids are dealing with, how we can treat them, the people that are working together to help parents and families overcome some of these difficulties that their children are having is really, really important. And I thank you, Kay, and thank you for the organization for putting this on. Thank you for having us.
Thank you. I really appreciate you guys. It's been a pleasure and honor to have you, to learn from you, and to always, now, it's good to build connections and to know people now, so I can refer people to you. Absolutely. As a teacher, I know now where to go. I have some connections, some good friends, so I appreciate that. And everybody, all our guests, we appreciate your attending our session today. This is only the beginning, and our mental health awareness events will be much more enlightening and more involving when it comes to children. And we will tackle along with a lot of more, topics that involved us as parents and our children and the community at large. I thank you all for joining us. Again, my name is Kayla Mufleh. I am the mental health coordinator for Rahma Worldwide, Mental Health America of Southeastern Michigan, and the program manager. Thank you all for joining us, and we will see you for another event with mental health wellness in Southeastern Michigan. Thank you all so much for joining us. I appreciate everyone's attending. Thank you.